VCU Medical Center is about a number of things. In Central Virginia, it's the major tertiary care facility with a wide range of services, a wide range of specialties. We're the only designated level 1 trauma center in this region, so we have a huge catchment area, which means that we bring patients in from all over. And it's about providing the highest level of care that we can, quality care.
The frequency of trauma patients is increasing by a proportion of about 20% each year for the last 2 or 3 years. We haven't been able to tell if it's all motor vehicle related, but it seems to be the entire gambit of trauma patients. So what ends up happening is on any given day, this room will be completely full with trauma patients.
The level 1 trauma center, as we call it, is the highest level of trauma center where everything is in readiness for the critically injured patient. And that involves having trauma surgeons like us in the hospital. They're 24 hours a day, they're here.
Not only does it provide a comprehensive level of trauma care, it's required to have all the respective trauma-related specialties, trauma, orthopedics, neurosurgery, all available on site. In addition to that, it provides for education, preventive programs for injury prevention. It's dedicated to research and education. Those other missions in a level 1 trauma center is different from any other kind of trauma center that provides for any trauma patients. We excel beyond that.
We also have an operating room that is in readiness 24 hours a day. So at any minute, I can ask for the operating room and have it ready for the patient within 5 minutes.
Speak up, Alexa, speak up. It's not a lack, it's just a punctate bleed.
Actually, packing his gun and the cartridge exploded and there was no other place to go for those pieces except to come on his face. This is what he's trying to pack.
Caliber is that?
So we're trying to see if there are any pellets or any fragments in the face, and he's actually bleeding from one side. Unfortunately, he's a previous heart failure patient, so he's taking some blood thinners. So that's another big problem. So they keep on bleeding.
Pain 0, 4, 5, 5.
Okay.
Nice.
Yeah. It's a big bullet. Yeah.
Look at the chest x-ray. I'm looking at not only the lungs to make sure there's no obvious life-threatening injury within the chest, but also at the bones, clavicles here, and the ribs to make sure that there's no fractures.
One of our first jobs is to check with the patient, if possible, to find out if there's anyone that they'd like contacted, because of course it's always comforting to have family here, and if there are any special decisions, want the next of kin to be able to be here and make them. Talk with the family when they come, we help support the staff, we help support the patients, we offer prayer if that's what they would like. We enter into people's lives at very intimate, sacred moments.
There's a whole different mindset when it comes to taking care of pediatric patients. In fact, there's no way that anybody can teach you to deal with some of the emotional problems that you will face as a physician taking care of patients. The death of a child or a serious injury to a child that's previously been very healthy is very difficult for us to deal with. And our first and primary thing that we have to take care of is the child and their family and making sure that they understand what's going on.
The reason why people get into our specialty is the challenge. You have an undifferentiated patient that comes in, no one knows what's going on with them, and you work through the process and you find out. You really do feel good that when you leave here and say, I saved a couple lives. I mean, honestly saved lives. And there's few specialties that people can say that, that on a given day, trauma surgeons, neurosurgeons, people that intervene acutely can honestly say they saved a life. And in emergency medicine, it's a good day when you've done that. You don't do it every day, but when you've done that, it's a good feeling that you've been doing your job right.
The environment is it's definitely very stimulating. It's very challenging at times. It's exciting in that, again, you really never know what's coming through the doors, and the fact that we can go from a period of relatively low volume, low patient acuity to having to really ramp it up to dealing with 7 or 8 operative traumas within an hour, and the fact that we've got the resources, we have the capability, we have the willingness of the staff to pull together to take care of those patients is exciting.
The patient's life is dependent on a team approach to it. Everybody has to know their role and what to do so we can expeditiously manage the patient. So that has to happen. And then the nurses and the doctors have to all be able to understand what each other's role is in a patient's approach to their medical problems. And patients come here in an undifferentiated manner. That means they could have anything from an arm pain that's really just more muscle to that could be in their heart attack. And by everybody doing their individual roles, we're going to find it out in a very short period of time. And minutes here are what the hospital looks at as hours, and hours here are like days upstairs. So everything has to be able to do that and do it well and not miss things. You have to have a team approach. Now, when things don't work out the way you want things to work out, and by no fault of your own, but that's just the nature of the disease or the injury, you suffer as a team. By having the team approach from the very beginning, they support each other. And we also have the support system as part of the team as chaplains and social workers and crisis intervention people that when they recognize that the team members are suffering from emotional issues related to that patient or whatever, their job is to support the staff.
I like to deal with people who are at that moment of crisis and opportunity because amazing things can happen at that moment. And I know I can be effective, and I know that I can help people through that time.
This is not a combat situation like they're in Iraq, but it's close to it in that the staff are put in positions where they may be injured, not necessarily physically, but emotionally. And you need to be able to take care of your staff so that they can come back the next day.
We also support the staff. We're a training institution here, and we'll have a lot of people here who have never been to one of these before. They're brand new nurses, they're medical students or whatever. And so in certain circumstances, we go ahead and pull them aside afterwards and see if they have any concerns. Or some of the doctors, if they've gone through a really tough code and they've worked on somebody for a long time and it hasn't worked out, and they may be the same age as the person, or they may have just had a death in their family or something like that. And so we help them as well. There's
chaplains that are assigned here primarily, and they watch the staff. They're constantly talking to the staff and finding out what's going on. And they watch to see if somebody's having an issue, and they either bring it to my attention or somebody else's attention. But if there's a particular event that is particularly traumatic, like a young child that has a problem, there are dedicated people that are crisis trained that will take the staff off somewhere and help them deal with that event. But the chaplains are here all the time, and they're here to support the staff as well. The way it's affected my life, I've gotten my affairs in order, okay? I've got my living will. I use the 5 wishes document. I've got my regular will in place. I'm taking care of business, and I have on